Hi, my name's Phil. I like talking about politics. In this video, I'd like to discuss a topic given special prominence with the local re-lockdown in Leicester, as well as the refusal of Boris Johnson in yesterday's PMQs to acknowledge the seriousness of the situation, namely hiding COVID data from those who need to see it in order to know what's going on in their local area. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So, quick catch up for those who were not necessarily aware. Boris Johnson, all-round cretin-in-chief of our government, has been throwing caution to the wind in smashing up lockdown restrictions quickly and deeply. Naturally, this is down to political pressure from within his party, as well, of course, the right-wing media. As a result, although the number of new infections is going down and the number of deaths is stable at an unenviable 900 plus per week, nobody seriously thinks that it won't get a lot worse later on. Now, the government have insisted on a whole nation approach, quite different from the regional approach that saner countries have gone for. Then this week, the city of Leicester went into tighter lockdown again. So various businesses that had been allowed to open were told to shut again. Schools were shut as well, despite the fact that a week ago, Boris Johnson was banging on and on to try and get the leader of the opposition to say that schools are safe. All schools are safe. But then, a week later, he shut down schools in Leicester due to a huge flare-up of infections in the city. But here's the thing. The local authority had no idea. They had been completely kept out of the picture. Not only did they tweet to say that the government weren't keeping them informed about the lockdown being reimposed, they were aware it was happening, but they hadn't had any real communication with the government. So what they were doing was tweeting out the message about what needed to happen, but to also say, the government aren't really giving us any details here. And they also had no data to judge the scale of the problem until recently. So they had to be told there was this massive flare-up in Leicester by the government because the data they had been given up until, this time was totally inadequate. Now, this is a chart from the Financial Times which shows what the problem is. So what you've got here is a bar chart for each particular day. How many new infections are for Leicester from two different sources, what's called Pillar 1 and Pillar 2. And the lighter coloured bars are Pillar 1 and the darker coloured ones are Pillar 2. And what you can see is, back in March, all of them were from Pillar 1, and later on increasingly and much more recently, the vast majority in the darker bars, Pillar 2. So what this is, Pillar 1 is data from hospitals. People getting tests in hospitals. And, similar organisations. And Pillar 2 is basically your mobile and other sorts of testing run by private organisations. Delwar is the accountancy firm that was given the contract to do medical testing instead of Public Health England. And of course, NHS hospitals. So what you've got here, and you can, as I say, really clearly see of the tests that were being done, and obviously bear in mind this doesn't mean that new infections has increased over time. Testing has increased and therefore you've had more results. But increasingly, the vast majority of the positive tests are being picked up outside of hospital. They're being picked up by this private company, and therefore the vast majority of new infections are highlighted in the Pillar 2 data. But here's the thing, until very recently, this data was not publicly available, and it wasn't available to the local authorities either. The local council in Leicestershire did not know this Pillar 2 data. All it had was the Pillar 1 data. Now, you imagine looking at this and just those lighter bars, and it looks like you've got very low levels of new cases. You wouldn't think there was a particular problem in Leicester. Now, if you'd have seen the full data some time ago, you'd be thinking, by heck, this is not good. And it was 6 or 7 times higher than they thought, the actual numbers. And this is a serious problem. So what you've got with the Pillar 2 data actually accounting for the vast majority of new infections, you can immediately see the problem for a local authority that is blind to these figures. There is no way that they can coordinate local services to deal with the issue because they don't know what the issue is. But they are the ones who have to coordinate those local services. Central government can't do that, can't possibly do that. This is why they were told at the start. I mean, for the last 10 years, the Conservative government have been removing the ability of regional trusts to be able to manage on the local level. But the government were implored to sort of put some resources back into this because we're going to need it. No, double down on it. No, we've got a better idea. We'll get an accountancy firm to deal with all these healthcare issues. And then that healthcare provider, that private healthcare provider, it's an accountancy provider, but for God's sake, doesn't even give the local authority the results of the test they're carrying out. You know, Keir Starmer tackled the issue with Johnson yesterday, but the Prime Minister denied that local authorities weren't getting access to the data. But that was just a barefaced lie. They weren't. They're all telling us they're not getting this data. Not just Leicester. Other local authorities are saying they weren't getting the data either. And it's not actually clear exactly who is getting this data other than the immediate government in Westminster, who are then not passing it on. The tests in Pillar 2 are carried out by private companies, like I say, but they do not pass the results on to local authorities or publish them. And this was verified by a government minister a little while ago, Nadine Dorries, who said that the company doesn't have to report its results to Public Health England or local authorities, which was somewhat contradicting what Boris Johnson was trying to tell Parliament yesterday. And it goes without saying that if local services don't know the picture on the ground, they cannot respond because they don't know there's anything to respond to. Now, this is going to make the situation much worse. And I fear we're repeating history here because the government are banging on about how new infections and deaths are coming down, which, as I say, is only half true. Deaths are not really coming down. This last week, there was like a dozen fewer deaths than the week before. And when you're talking over 900 deaths, that's insignificant. So the number of deaths is remaining fairly stable and high. It'd be nice to think it was coming down. But the number of new infections is coming down. But then that makes you wonder if the deaths are fairly stable, if the number of new infections is really being reported properly, or is it being deliberately downplayed, especially given that the data that's being collected, the majority of the data that's being collected, we can see in that Pillar 2 from Delwar, the private company, is going through government before being filtered through to anyone else. But, they keep saying these figures are improving. That is the key thing. They keep saying the figures are improving. Well, here's the thing. I'm old enough to remember when the government was saying just how much our figures were way better than, say, Italy or Spain or France. And they loved drawing these international comparisons, even though we were behind the curve. We said, if we look at Italy and Spain and France, way more deaths than we have. And of course, at this time, we were downplaying our number of deaths. We were fiddling the figures. But the key thing is, we know what happened then. When they were cock-a-hoop about our death rate, when they said that actually we were managing things well and that our data was somehow good. We knew what happened after that point. The government no longer liked to be compared with Spain or Italy or France. Not at all. Oh no, it's not appropriate to draw international comparisons. That's what they now say. And I think the same thing could very well be happening here. They are lauding these lower figures. At the moment, we're in a snapshot of time when they think the figures are good. They're not. 900 odd deaths a week is not good at all. There are some populous countries that don't have that much since it started. But anyway, it's they're lauding them as good figures in this snapshot of time, just like they did when we were early on in the curve there. And they're saying that that is linked to their handling of the situation. But when the figures come out that actually represent their handling of the situation, what then? When it becomes apparent that all of a sudden they don't, they go back to not wanting to talk about the figures. They don't really want to, we really shouldn't be talking about, the number of new infections or anything like that. When it goes back to that because the numbers increase, what then? And it seems to me to make no sense for the government to deliberately hide data from the local authorities when that will inevitably lead to more deaths later on. It has to. How can it not? Because it means you've got this huge delay in responding. And they won't be able to hide the death figures. So why are they doing it? You know, if the data exists, why are they not giving it to the local authorities? The suspicion, and it's a suspicion I share, is that the reason this is done, because it sounds perplexing, is purely so that they could justify scaling down the alert level to trigger the easing of the lockdown. And no more than that. In order to ease the lockdown the way they had to argue that their made-up level 4 had changed to the made-up level 3 alert level. And in order to do it, they needed something to base it on. So they have deliberately suppressed the number of new infections. And the way they've done that is to keep that information secret from everyone, including the people who need to know, local authorities. Short-sighted, you may say. Yes, that is a feature of this government. How do we stop tomorrow's headlines savaging us? That's all they seem to think about, and as far ahead as they seem to think. But anyway, those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.